You're going to be dead before this process even finishes.
Is it not just a form of population control?
Do you want population control? So that's what you're advocating for. I think this bill reads like it's been written by a 3-year-old.
People getting to choose when they die. I'm Garcia.
And I'm Izzy.
And welcome to Informally Informed. So today we're going to talk about the assisted dying bill that's been proposed in the UK. Obviously it's been read in Parliament, it's been voted on, and now it's in the House of Lords.
Yes, so it's passed through the House of Commons. It's now gone to the House of Lords for them to read it, make a decision, and either pass it or knock it back. What are your thoughts?
I mean, so I obviously work in a hospital, as do you. And I have seen people who have wanted to die but couldn't. I think that we do it for our animals when they're suffering. We make that choice ourselves. And so we should give people that same choice. Now, in terms of the bill itself, it's been quite controversial because people think it will be abused. But it's like with any law in the UK, once it passes, it will be enforced, especially in a medical capacity.
Yeah, so as far as I'm aware, the main point of controversy is this whole coercion thing.
Yeah, for under 18s. Do you mean the idea that they can't bring it up to medical professionals can't raise it to under 18s, or do you mean general coercion?
I just mean general coercion.
Okay.
No, there's no under 18s that are allowed. This is against the law. Yeah, no under 18s, period, which I think is too young. Straight off the bat.
I don't know that I agree that it's too young, because in the UK, at 16, you can join the armed forces.
That's also too young.
It's too young, but it's something that's enforced under law. So if we're giving people that ability to go to the GP, your general practitioner, the doctor, on their own at 16, then I feel like they should be able to be given the capacity. If we're saying they've got the capacity to make medical decisions.
I'm not saying they do.
No, but the law already says that they've got capacity to make medical decisions. Then I think it should extend to them to make those medical decisions.
No, I think 80, I think maybe 21. The
21?
brain doesn't stop developing until the age of 25. People that make decisions at this age are incapable of fully understanding the long-term consequences. This is a well-known fact.
It is, but I think that's not something that's enshrined in law. That's something that we know intellectually in science, but it's not something that's enshrined in law. And we're talking about law here in terms of this bill.
And I'm saying that the law in this case should be older.
And I don't know. I don't disagree, but I also don't necessarily agree. But also, I guess my part of disagreement, because we discussed this previously, is on psychological or mental illness, essentially, because it's not covered under this law. And there are people that suffer from mental anguish, shall we say, that don't lead what we'd consider normal lives. And I feel like they should be given consideration under this bill.
Yeah, so this bill is basically, for those who haven't read it, I did.
I read it.
57 pages of it.
We read it. We both did. We discussed this. We read it. It was arduous, but we read it.
It's only for people that have a prognosis of 6 months or less. So a physical disease or illness that will result in them dying within the course of the next 6 months. Which seems...
It seems a waste of time to me.
Yeah, it seems like a bit of a waste of time to me as well. I'm not saying that, every day doesn't matter when you're in a lot of pain or anything like that. But this bill, first of all, there's the first declaration that you've got to sign all sorts of documents to say you are who you say you are, and that you've not been coerced, but anybody that has been coerced would have to sign it anyway, so I don't really see the point. Then it's got to go to 2 separate assessments, and 2 medical professionals have to agree that you fit the criteria. But if one medical professional thinks that you don't agree, you can then seek approval from somebody else, and then it's fine if they say you can agree. So what's the point of having two people in the first place?
But also, if
And
you're
then it
given
goes-
that prognosis of 6 months, who lives to 6 months?
Hang on, and then you've got a 14-day cooling off period, and then to make sure it is what you want, and then you've got another second declaration where you got to sign all the stuff, and then you've got to go to the doctor for them to provide you with it. It
And the
just
High
seems
Court,
like a
the High
whole
Court as well.
yeah.
You have to
and
go
then
to the High
there's there's a review, assisted dying review panel that have got to agree to it, and then these two people that are doing the assessment, they've got to read through all your forms. If the maximum time that you have a prognosis for during the preliminary discussions is 6 months, and that's maximum, you're going to be dead before this process even finishes.
Yeah, and I feel like we are supposed to lead with dignity. You are stripping away someone's dignity by making them go through all of that bureaucracy to get to death. I don't understand how it is that we as a society got here. Because I remember hearing about Dignitas when I was quite young. And I don't think that they have as many checks and balances as we do they? I'm not sure because Dignitas is the Switzerland.
All right. Don't think so.
I don't think they do, and also your mental capacity has to be intact, and that's a big one. So if you've got brain cancer, for example, given a 6-month prognosis, your mental capacity is not going to be intact.
But at the same time, they also think that they're going to assign somebody I can't remember what the phrase an independent advocate to explain to people with autism and learning difficulties what the result, that don't fully understand, to help them explain. So either they've got capacity or they don't. How can you say in one breath we're only going to allow people that have capacity to do it, but then in another breath say, well, if you've got learning difficulties, that's fine, we'll just get someone to explain it to you in detail first. Either they've got capacity or they haven't. And there's number one. Number two, there's no explanation of the level of learning difficulty. Someone, can have severe learning difficulties that doesn't understand, is never going to understand. But as long as somebody's explained it to them, I guess they do now.
Then there's the proxy situation. So let's say you've got an intellectual disability and you're carer, because we do mandatory training, right? We both do mandatory training, and part of that is that you're more likely to be abused by carers than you are anyone else within the healthcare setting. If they are fed up of looking after you and they're your proxy, you're gonna die. Do you know what I mean? Their argument of abusing this bill. The abuse is built in, for me. It's built in and it's not been thought through.
But at the same time, a proxy would also be used in the case of somebody like Stephen Hawking. I know he doesn't fit because he had more than 6 months left to live. But locked-in syndrome, things like that, where people are physically incapable of writing their own names but are mentally sound.
But look at things like... but then that's the other thing, locked-in syndrome. Stephen Hawking was rich. He had the ability to afford that expensive-ass computer. I looked at how much it cost, and I didn't write it down, I can't remember. But it cost an absolute bomb. There's people with locked-in syndrome that simply can't afford such things, and it's not going to be provided on the NHS.
Not to that level. So there's things that are provided and things that aren't provided. So everybody gets a crappy little chair. And then the longer you have the disability, you are upgraded, as it were, moving on to the next more expensive thing, and then your old discard gets sent down to somebody who's just been diagnosed. That's how it works. But even then, it's not like... If we had private healthcare,
I'm not going to go there with this whole thing with private healthcare in NHS.
Would be covered under your insurance, but they're not.
But at the moment, the checks and balances that they're trying to put in place to stop abuse, it's not going to work because it's built in. That's where I looked at it, and at the end of it, no matter even from page 1 of 57, I thought this is not gonna work.
All it takes is for one woman out there who fancies getting a hand on her mother's will 6 months earlier to convince her that it's the right thing to do for the whole family.
Yeah,
And that mother is going to have no idea that she was coerced.
indeed. But let me bring this back real quick to psychological or psychiatric illnesses. Okay, this bill doesn't touch on it at all.
It's not included.
It's not included, and they've purposely excluded it. But there are people who, like, obviously, as I said, I work in psychiatric nursing, right? There's a lot of people out there who have no quality of life, who have tried multiple times to end their life, but it's not worked, or have ended their life and then it's become a massive we need to learn from this situation where the person that's looking after them is blamed, when this could have been avoided had we given them the choice. And I think that this is my issue with government interference. I'm not going to say this every episode, I promise.
However, I looked at the Canadian bill that was brought in 2016, but it was changed in 2021.
Yeah.
To include basically anybody that feels like it. This is what it says. It's available to those who meet the following criteria. A, they have a serious and incurable illness, disease, or disability. B, they are in an advanced state of irreversible declining capability. Or C, they have enduring and intolerable physical or psychological suffering that cannot be alleviated under conditions the person considers acceptable. Now, since that change in law, 2023, latest stats, 4.7%, basically 1 in 20 people that died in Canada died due to assisted dying. Now, that last one, enduring an intolerable physical or psychological suffering that cannot be alleviated under conditions the person considers acceptable, basically means anybody that stands still long enough. I wake up one morning, I want to die today. Have you tried this? I don't find that acceptable. I want to die. And I know a lot of people, like I could sit here and list at least probably about a good 10 people off the top of my head that at some point in their life have felt suicidal, that are now loving their life.
Mm-hmm.
Those people are turned around at the point and gone, oh, you know what, because of this, I want to end my life. You've got to be very careful when it comes to psychological suffering and giving people the option. Now, I'm not talking about the people that have been in and out of care for 30 odd years, in and out of mental homes. But you'd be surprised how many people in their lives look back and go, I felt suicidal, I thought about ending them, and now I couldn't be happier. Those are the people I'm concerned about.
I mean, you know I'm smiling, so I'm about to say some shit. What about those people who, why shouldn't we give those people a choice? Is it not just a form of population control? And if you don't want to be here, you're not contributing to society, why shouldn't you be given the choice to die?
What about the people that change their minds? Which is more than the people that are presumably in and out of care for like 30 odd years.
Yeah, but we're just guessing at that because, I mean, working in psychiatry, because obviously this doesn't even cover psychiatry anyway, but in Canada it does. There's a lot of people with serious and enduring mental illness who are I am going to say that I don't want to say that they're a drain on society. I'm saying that they're not contributing effectively or positively to society.
So are those the two options we have then? Either we allow anybody who feels like it to kill themselves and, oh well, never mind about those that would have changed their mind. Or do we go, we don't allow anybody with psychological suffering to kill themselves and be damned to those who spent 30 years wanting to end it?
Or
is that what we're arguing about?
I think, no, it's way more nuanced than that.
Of course it is.
But I feel like we should, if we're giving people the adult choice to do this, then we should give people the adult choice to do this. And Canada's done that.
So how would we do that? But they haven't. They've said anybody that feels like it can. That's basically what they're saying.
But that's what it's, I did look part of that up. That's not the reality of the situation. So even though that's what it says, that's not the reality of it. They still have to go to the doctor. They still have to be able to, it's a serious and enduring illness. So there has to be medical records for this. Because I did briefly look this up after we discussed it on the phone. And there is actually checks and balances on this. So you can't, it's not just as much as I feel like it, therefore it is. Even though the bill itself is written that way. So I don't know, but I also feel like in a society, our society, where you can't even get into your doctor.
Do you want population control? Because that's what you're advocating for.
I'm aware of this. I knew how it sounded from the moment I wrote it down. We're in a society where there aren't enough resources. We're already doing stuff that is population control. So why not do this?
So you think what? So your argument is
Kill them all. No, I'm joking.
Assisted dying is good because it helps the economy.
No,
wasn't slavery
it's
good? Didn't that help the economy?
Don't even go there.
What about like all the other things?
No, it's not good because it helps the economy. It's good because it stops the drain on society, that the situation wherein we have to keep
It's the same thing.
No, but in this country we have to keep them alive. I'm not advocating for using it as a form of population control, but I mean, the way that I look at our society now, it's the winter fuel bill was population control because it's killing the elderly. So why let
that wasn't intentional.
Well, but it did have knock-on effect in terms of where people are now. There aren't enough hospital beds to house them. We don't have institutions anymore in the same way that we did. I mean, I don't even know why I'm arguing for the psychiatry bit because it's not even included in the bill. But there's a lot of people with serious and enduring mental illness, and I think that this bill doesn't go far enough. But it made sure to include all the checks and balances, all the way that it's going to keep people alive. But in a society where we just don't have... We have a growing elderly society. People are not having as many babies to replenish that anyway. The workforce, the society can't actually afford people now. We need to do something. We need to give people the opportunities to do that. And at this time, people are going to Switzerland to spend their money to do it privately there.
But this isn't going to do that because they're only going to be living for 6 months.
6 months anyway. Yeah. I think that this
it's not
bill...
even if it's like, oh yeah, let's kill people so we don't have to, the ill, so we don't have to spend money on... We wouldn't be spending money on their palliative care anyway, because they won't be living for very long. And I can't imagine the death drugs are going to be particularly cheap.
True, but in a sense that we already pay for palliative care. We already provide the death drugs. They're just in different doses. We already do this. So why put this much checks and balances in place to potentially put people off from doing this? And I guess that's where I'm at.
I think this bill reads like it's been written by a 3-year-old.
Oh my God, I'm so glad that you said that.
So somebody will say like, oh, well, have you thought about what if they change their mind? So then they're sat there going, what if they... I know, we'll just put a 14-day cooling off period in there. That's what it sounds like from reading it.
It feels like, even though medical professionals agree with this bill, I guess if we're looking at it as just the first step to giving people the right to choose, then yeah, I guess it's needed because it has to start somewhere, right?
Yeah, so with regards to the moral implications, I'm not religious, so I don't believe that suicide sends you to hell, any of that. I'm not down with that.
I am religious, but I still don't believe that suicide sends you to hell.
I don't think doctors should be allowed to use their professional, because it says this, doctors should be allowed to use their professional judgment to bring up at any point that they feel necessary to tell you about this. If somebody says, I want you to explain every single option to me, don't leave anything out, fair enough. But if I sat down with you and went, oh, by the way, you've only got 6 months left, I can also say in my next breath, have you thought about killing yourself? Without explaining all the other options. I've got the right as a doctor to do that. I don't think that should be allowed. I think it's a slippery slope to state-sanctioned death. And I think...
I can see that. I can see your point. I'm not going to fight you on that one because I do think I think that anything that gives... Any law is a slippery slope into something.
Yeah. And I don't think... Again, I don't think it's about the government wanting to spend less. If it was... a long-term, like any long-term illness and all that kind of thing, then yeah, obviously there'd be less benefits.
I think
less pensions being paid out.
Yeah, exactly that. The government I don't think they look at anything from an altruistic point of view.
But that's not relevant to this bill because it's prognosis of 6 months or less.
Yeah, and I guess that's the other thing. Like, you've been suffering with this illness for, let's say, something like some forms of pancreatic cancer, for example, that kills you fairly quickly. And you're more likely to die from it, okay? That devolves quicker than 6 months.
Yeah.
I've never known anyone with a diagnosis of pancreatic cancer to live more than 4 months.
Yeah.
So by the time you've come to it, you're dead anyway. You're not, the government hasn't saved anything. They haven't saved people's dignity. And, you know, the NHS is already crumbling. So add on to that, people that can't already get appointments, having to have 2 doctors to do this. There's already a brain drain in the UK wherein all the doctors are leaving anyway.
But
so
that's
we're going to find them.
That's also not to say that, you know, people with pancreatic cancer might choose not to use it because, you know, they've been hit with something. They've only got a few months left to live.
I mean, I can see the positives, but I also see it's not so much drawbacks of the proposed bill itself. It's how it doesn't go far enough. I don't think it goes far enough. 6 months is nothing. 2 medical doctors when you can't even get an appointment anyway is nothing. Our 2-week rule for cancer has gone out the window. It has.
I mean,
It has.
can't speak to other hospitals, but certainly not in the place that I work.
Definitely in the hospital that I work, it's gone out the window, because I was speaking to a doctor about this. Because obviously I was doing the research on this. I asked a number of doctors their thoughts on it. Quite a few of them disagreed with it altogether. But not necessarily, but those ones were quite obviously religious. And that's the other thing. Professional bias. If you're supposed to be using your professional judgment, they do say that you're not supposed to talk to your patients. As nurses, it's in our code of conduct that you're not supposed to talk to them about religion. If you've got a patient who's enduring serious mental illness and they want to talk to you about their religion and all the rest of it, and you can commiserate or anything like that, they also encourage you to try and talk to them in a way that they understand. So how is that, or in a way that is relatable, that you can relate to your patient, building a rapport? How is that not going to have a knock-on effect? Do you know what I mean? How is that not going to... You could dissuade people from doing that just through the sake of religion. Imagine, like, because in this country we do have a large Muslim population. We have a large amount of Muslim doctors as well.
There's going to be no Muslims signing up for this.
And if they do, they wouldn't be able to go and see their Muslim doctor for fear of repercussions. You know, it's... I feel like this wasn't a well thought out bill.
Yeah, no reference to religious, to any sort of cultural nuances or anything.
No,
like
exactly that. It didn't look into it enough, because even in Christianity, which this is supposed to be a Christian country, suicide, anti-biblical.
True, but on the other side of things, why should it? Because I'm going to assume that people that are hardcore Christians that believe suicide will send you to hell would rather endure their final couple of weeks being alive than risk going to hell.
But is it technically
So
suicide?
this wouldn't apply to them.
Is it technically suicide?
Yes.
Is it though?
The doctor is not allowed to administer.
You have to administer
You have
it
to
yourself.
administer yourself. The doctor is not allowed to administer. They are not allowed to leave. They don't have to be in the same room as you, but they can't leave the premises until either they've changed their mind, they're dead, or it didn't work. One of those 3 things needs to happen. But the doctor is not there to administer. The doctor is there to hand that person the thing or give it to a relative for them to do.
And then that's the other thing.
And also
If
the
you
doctor
don't
has
have
no
family,
obligation.
Let's say you know what I mean. Let's say you are then in a situation where you want to die, but you have no family. You've lost the use of your hands, but you still want to die. Who's then going to perform that for you? You've been through all the checks and balances and all the rest of it, but you can't you can't do it yourself. There is no what's the word? There's no nothing in place to say that anyone can do it for you, because if you do that under your own, if a nurse does it, you'll be answerable to the NMC and to the law because you have in fact killed someone.
I think what they should have done is just decriminalised
Suicide.
relatives coming back from Switzerland and suicide.
Suicide is still illegal in this country.
And
Even though it's a
also-
grey area, it's actually still illegal.
And also, that doesn't... It doesn't... The whole thing with psychological thing, and I'm not saying this is a big issue, I'm not saying it's going to be a major issue, but something that sort of I thought about is the people that are suicidal, that want to kill themselves because they think no one's going to remember them. I know one way to get people to remember me, I'm going to jump off a bridge. This, even if it implies the psychological suffering, wouldn't encompass those people because they'd rather just jump off the bridge. They'd rather stop the traffic. They'd rather jump in front of a plane because at least someone will remember them. I'm not saying it's a big percentage, but it's there.
I'd say it's quite a small percentage because I work with a lot of people with personality disorders whose lives they'll never be able to work or anything like that, and they actively try to commit suicide. The problem with that is you could end up losing your registration as a nurse if they commit suicide and you're in their presence anyway, because you've not actively stopped it. Even if you've tried to stop it over and over again, you've still got to go answer to it for it in court. So I feel like if we do this and include psychological illnesses, then we'll probably be in a position wherein there'll be more beds on wards for people that are actually, do you know, in my working career these days, you see less serious and enduring mental illness than you do anything. You don't see what I call classic mental illness, which is bipolar, schizophrenia. You're more likely to see personality disorders now. People who will do those things that you've just said about jumping off a bridge just to stop traffic.
Yeah, but that's not the majority of people that work.
That's the majority of people that I come in contact with.
Yeah, because you work in mental health.
Yeah, because I work in mental health.
It's not that I don't work in mental health, and that's not the majority of people that I come across.
But then even look at like powers of the police, the 136, right? Police will bring people who are doing these things, who are wanting to jump off bridges, to A&E, which then clogs up A&E. We could potentially, or if you've tried to end your life and the police are called on you, they still have to act.
The other thing I would also say is the people that are in that situation, regardless of whether this is a good bill or a bad bill, even if they brought in a bill tomorrow that you thought was absolutely fantastic and the perfect bill and had all the best bits that you wanted without any of the negatives in, you know, some weird fantasy land, even then, that would involve applying to end your life. Most people, there are exceptions, obviously, are not going to want to sit around filling out paperwork that are suicidal. A lot of these suicides are spur of the moment kind of decisions, and by the time they filled out the paperwork, they change their mind.
I mean, I guess that's guessing on both our parts, because I feel like if they are constantly trying to end their lives and then you're giving them now an option to do it decisively, they're more likely to do the decisive one that they know it's going to end. But then also, I look at this, right, and I look at all the people that will, I mean, I'm not trying to be funny, but if I had 6 months left to live, I am doing all the fucking shit. I'm doing it all, and then I'm applying to die anyway.
You're not sitting around filling in paperwork.
No, you're not. I'm going committing crimes. I'm going to be dead anyway. So I look at those things and I'm like, yeah. And then I also think, how many people really are given that prognosis because they can't get into the doctors to even get that prognosis? They just die.
Yeah. And I don't like this whole 6 months left to live thing.
I think that's where I'm at.
I think that's stupid.
I think that's where the sticking point is for the both of us.
I think if it was longer, I would be okay with that. I just think it's a lot of paperwork for only 6 months. I think that it doesn't encompass things like, I don't know, MS as an example, Parkinson's, which is
degenerative.
All of these really debilitating diseases that will really affect quality of life. You could be sat there, unable to move any part of your body, being fed through a tube, like locked-in syndrome, literally like this. But your brain be 100% fully functional, and not being able to literally move any part of your body, being fed through a tube, have your arse wiped for you, all this kind of stuff, not being able to communicate with anybody, not being able to do anything, people ignoring you, because guaranteed the nurses, they'll come in, they're looking after you, they'll have their own conversations, they won't bother to engage with you, because people that can't respond are less likely to be engaged with. People like that should have but you could live for 20 years like that.
And if your proxy decides that you are suffering, then that's it then for you, and you're locked in. You can't say anything different. And I guess this is where I'm at with like the mental capacity stuff, because if you won't be able to have mental capacity then, so how does that then work?
Well, you'll have mental capacity, and there are ways to communicate. Blink once for yes, twice for no, that sort of stuff.
Yeah, but that still wouldn't come across as mental capacity because you've got to have the ability to be able to understand and retain information.
They do, but whether other people know that they do.
That's what I mean. How are you going to be able to prove capacity? Do you know what I mean? I feel like they haven't actually thought about this. Well, or they have, but it was written by politicians and not by doctors.
Anyway, we'll leave that one there.
We will.
Let us know your thoughts, guys. Let us know your thoughts. What would you do in that situation?
Yeah, what do you think? Should psychiatric illnesses be included?
Yeah, that's the big debate, I think. The main disagreement. Yeah, let us know and we'll see you in the next one.
Bye. Let us know if you agree or disagree with any of our views. That's the point of the conversation. Join in.
Don't forget to like, subscribe, and hit that notification bell.